Hi, Dr. Smith. Well, it only seems right for the number of times that I put you in front of a TV camera that I at least do it once in return. So I just want to say thanks for everything you did during the Ebola crisis and while heading up the Biocontainment Unit, for sharing your expertise and your knowledge and just for letting Omahans know that it was going to be okay. And you just have done so much for the university and for Nebraska medicine. And I just remember the times that we were in the midst of things and you'd worked such long hours and I had to come to you and ask you to do this interview or that interview and get in front of a camera, and you were more than willing to do it. So I can't tell you how much I appreciate that and how much I would like to thank you for that. And I hope you have a great retirement. Hope you enjoy it thoroughly, but make sure you stop back here periodically so we can check in on how you're doing.
Thank you, Dr. Smith, for everything you did. Congratulations on your retirement. I'm so excited that I had the opportunity to take care of Ebola patients. That's something I never would have done without you being the brainchild of this operation. Congratulations on your retirement. We're going to miss you. Come back and see us often.
Hello, Dr. Smith. I just wanted to thank you so much for all the great, kind care you gave to us as a mentor and as a physician. Thank you so much.
Hi, Phil. Jolene here. Just want to thank you for the opportunity that you've given the radiology department to be a part of the Biocontainment Unit team. I'm honored to be the first person to x-ray an Ebola patient. I think this is a really great team that you've been leading, and we're really going to miss you, but we also hope that you enjoy your retirement to the absolute fullest. You deserve it for all the hard work that you've done over the years, and we just hope that we hear from you from time to time and check in, because we will be missing you around here.
Hi, Dr. Smith. Have a great retirement. I'm really going to miss you. I loved working with you in infection control and finding you all over the campus where they kept moving your office. Good luck.
I would like to thank Dr. Smith for the legacy of the Nebraska Infection Control Network. He's done so much for it. I just hope that those of us who are left can sustain it as long as its current 30 years. So here's to 30 more.
Hi, Dr. Smith. I'm a newer face to you, but I've known your face for a long time. Thank you for NICN, and I hope you have a good retirement.
Congratulations on your retirement. On our last travel for the Gehring Biocontainment Unit Symposium, I reminded you of how in 1980, my first job at Internal Medicine Associates, you were part of that group. And so I've known you for a long time, and so excited for you to finally enter a new chapter of your life. Enjoy.
Dr. Smith, I've had both the pleasure and the privilege of knowing you and working with you during my entire public health career. You have been an advocate for public health that entire time. You have helped us countless times during those years with public health issues. I admire you. I admire your vision. I admire your dedication, your contribution to the community, and your contribution to medicine, infection prevention, and public health. I wish you all the best in your new journey, along with a lot of laughs and a lot of joy. And I want to give you one final thank you for everything you've given to this community, because you're going to be greatly missed by all of us.
Dr. Smith, I wish you all the best for your retirement, and I couldn't have asked for a better public health partner than you were. I never forget, there were times during the Ebola crisis where I didn't want to receive any phone calls from you, because I knew they always meant there was potentially a new Ebola patient who was going to come to the university. Not that I doubted that the university couldn't take care of it, but I knew there were always the possibility of excitement in the community and also healthcare providers who could be infected. I also never forget the time when we were in the emergency room at 10 o'clock at night, calling a medical student who had provided CPR to a high infectious monitoring patient for Ebola. The compassion that you showed that night, it really told a lot about you. And so I appreciated all you did for public health. You were a true champion for public health, and I wish you the best for your retirement.
Hi, Phil. I wanted to wish you the best in your retirement. I know that we're going to be in touch very frequently, but I wanted to sort of remind you of one thing that sticks in my mind, and that is in the summer of 2002 when all the post 9/11 dollars had come to Nebraska, and you called me, and I was on vacation in Wyoming, I think, and you said, Sharon, I have 15 months worth of salary for you, and we're supposed to build a training center for disaster preparedness. And you asked me if I was willing to take a risk, and I said, sure. And here we are 15 years later with a robust training center that employs 6 people to 8 people and a full academic program where we're growing our student body and changing the next generation. So thank you from the bottom of my heart.
Hi, Dr. Smith. I just wanted to take some time to tell you that I will be missing you so much once you're gone. I want you to know how much of an impact you've had on my career and how much I've enjoyed working with you, especially since I became a part of the leadership team. You've pushed me to do things that I never thought that I would do, and you've had a lasting impact in the rest of the course of my career. So I hope you enjoy this upcoming time with your family. Make sure you come back and visit us often, and I'll see you soon.
Phil Smith was an outstanding leader in the infectious diseases and in the biocontainment unit process. He was very bright. He knew all about and learned about Ebola and handled the patients beautifully. I want to congratulate Phil on a phenomenal career, and I wish him the best. Sorry that he's stepping down, but I'm sure there'll be others who'll take his place that'll be equally as good. My best wishes to you, Phil, and I hope all goes well for you in the future.
Hi, Phil. I always knew that one day you would be retiring. I just never really thought that it would be this soon. I really wish you well in your retirement, and I have got so many wonderful memories of when the unit was started, how we put together all the protocols, all the work we did. And I think it's just wonderful that you're able to retire after we were able to prove the success of what your dream was going to be. I love you. Bye. Oh, and enjoy your retirement.
Hi, Phil. So glad to take just a quick minute to recognize and celebrate you, to congratulate you on not only a phenomenal career, but also all of the amazing things that you have done for us here at Nebraska Medicine, within the community, within the region, within the state, at the international level with our biocontainment and Ebola work. I knew you before we actually opened the biocontainment unit for our Ebola work, but I must say I really got to know you during that time, and what a privilege it was to really see and appreciate all of the talent, the expertise, and most importantly the commitment to patients and patient care that you exemplified, and the incredible leader that you are. We're going to miss you. But we know that you're off to bigger and better things. So on behalf of all of us at Nebraska Medicine, congratulations. Thank you for everything that you've done. Enjoy this next phase of your life, and always take great care. Thanks again.
Hi, Phil. When I think of you, I think of an effective leader, somebody who is humble and yet very strong, and I think you're the type of leader that we all want to aspire to be. We've had some amazing times, especially over the last couple years, and I am truly honored to call you my mentor, and I'm absolutely proud to call you my friend as well. I hope that you enjoy your retirement, and I know that you will. And I expect a call when you're on the way to Mulhall's at 10 o'clock in the morning on a Tuesday to rub it in a little bit, and maybe we can meet for lunch on that day. Take care, Phil, and good luck with this next phase.
Hey, Phil. As I was trying to think about what I might say to you, it came down to very little words and more about just kind of that human connection. So, especially during activation and the care of our 3 patients, you and I greeted each day with a hug, and it was kind of our unspoken way of telling each other that I know how hard this is, and kind of our concern for the responsibility we had for our team. And so that was something we shared, and I feel like we'll continue to share even for the long term, and I look forward to having you as emeritus professor and still seeing you in the halls during our drills. So thank you. We will miss you, and I have no doubt we'll stay in touch.
Phil, this is my opportunity to once more say thank you. Thank you for all that you've done for this great university, for the Med Center, and for this community for many decades. Thank you for your leadership, and thank you for your friendship. I have learned a long time ago that great leadership is forged in the crucible of crisis. You have undoubtedly proved that time and again. My very best wishes to you in this time.